Afternoon, everyone. I welcome you all into this webinar, and here we have Dr. Rohan with us. So,
Oh,
just a brief introduction. Welcome, Dr. Rohan. At
thank
the
you.
outset, I thank you for agreeing to do this webinar for us. Thank you so much for that. And just a brief introduction about Dr. Rohan. He is one of the full-time tobacco treatment specialists in India. It's so nice to know that, Doctor. And he has a bachelor's degree in homeopathy from C.M. Patel Homeopathic Medical College in Bombay. And he also has an MBA in social entrepreneurship from Narsi Manoji Institute of Management Studies. So he has more than 15 years of experience in medical field, and he's currently working with an NGO, Indian Cancer Society. He has worked on one international project with senior oncologist Dr. Sultan Pradhan from Prince Ali Khan Hospital. Sir is a very well-known oncologist. I have highest regards for him. And also, he is working with Dr. Nancy, who is a pioneer in tobacco cessation clinic, Boston, USA. He's a professor of medicine in Harvard School. So Dr. Rohan has counseled more than 5,000 patients and he has conducted more than 500 awareness sessions. That is quite a lot in number, I would say, Dr. Rohan. And he has also conducted tobacco de-addiction camp in traffic police stations in New Bombay in collaboration with D.Y. Patil Physiotherapy College. And he was invited to Nagaland by the governor of Nagaland to conduct camp and spread awareness. And he's also known by the name, wherever there is smoke, there is Dr. Rohan. Right? This has been featured in the newspaper Midday. So it's our pleasure to invite you
Thank you so
in
much.
today's session, and the platform is yours. You can start.
Thank you so much for the warm welcome and for the introduction. I'll just share my screen. Is it visible to all? The presentation is visible?
Yes, Dr. Rohan.
Okay. So thank you so much, and without wasting any time, I'll come directly to the point. As ma'am introduced, I'm working with Indian Cancer Society. Indian Cancer Society is a very big and old organization working for cancer prevention, cancer awareness, cancer early detection, and also supporting cancer patients in the empaneled hospitals and also cancer rehab. So it's doing a great job, and I'm part of the awareness department where I take care of the oral cancer and tobacco cessation awareness. So, why there is need and why this particular session we are conducting today? The reason is if you go through the data, it will come to know there was a research done in 2009-10. This was the Global Adult Tobacco Survey. This Global Adult Tobacco Survey, the GATT survey, what we call it, it is a pretty, a big level survey where World Health Organization and Indian government is also involved. So it's pretty authentic also. It is being done in almost 22 different countries across the globe, and India also does it. So when it was done the first time, the results were really very shocking. Like 48% of males and 20% of Indian females were into use of some other kind of tobacco product. So imagine 48%, it's almost 50%. So it's a huge number. When this survey was repeated again in 2016-17, the results were almost 42% and 14%. But of course, you can imagine the population has also increased. And when we talk about 135 crores of population, and even 40% of that population is a big number. So there is a huge population of in India consuming some kind of tobacco products, and because of that, we have all the related diseases because of it. Cancer being one of the major things. So, like 40% of all cancers are tobacco related. 90% of all oral cancers are tobacco related. So, we are today the world #1 in oral cancers. So that is the reason we need to talk about it in detail, and we need to understand about this subject. Though this subject, people feel it's very common, but a lot of misconceptions regarding this. So that is the reason of this particular session today, that all these misconceptions should be cleared and we should take this information to more and more people. I'm not here because you all are consuming tobacco or I want you because you are into it and I want to make you to it. But I want this information to go to more people. See, I cannot reach to everywhere, but I want this information to go to more people so that they come to a level where they make a proper decision to quit and you help them to then how to quit. So let's start with the session. So when a healthy person comes in contact with tobacco, what people don't know and what is the reality is that reality is this. So we need to show the people what is the reality. Unless we don't show them the reality, they won't come to know. We work in the hospital or we work in medical field, so we know what is the reality. But this reality is not known to the general public. So we need to tell them about this reality. So where does tobacco come from to begin with? So tobacco comes from a tobacco farm. Basically, these are the tobacco farms. They are the shrubs where it, of this height. But why I'm showing you this because most of people don't know from where tobacco comes and they feel they see that products directly. But one important thing about tobacco farm is this tobacco farm is the only farm which doesn't require fencing or which doesn't require protection. The reason being even animals don't eat it. So the point is not that a thing which animals don't eat should a human being should eat or not. I mean, it's not an eatable plant. But why animals don't eat is a question. So if you take a tobacco leaf from the farm and give it to a laboratory just to understand what are the different chemicals present into it, even at that time, even in the tobacco leaf from the farm has a lot of chemicals which are poisonous. Even that plant leaf has nicotine into it. So you need to understand that even the plant is not an eatable plant and at that time there are poisonous chemicals present. Over a period of time, what happens is when the cigarette making companies make cigarettes and when the gutka making companies make gutka and other products are made, they add a lot of other preservatives and are more chemicals into it. And the latest protocol says that when a person is smoking a single cigarette, single cigarette, he is exposed to almost 4,000 to 7,000 chemicals. Yeah, you heard it right. It's almost 4,000 to 7,000 chemicals. Out of this 4,000 to 7,000 chemicals, 200 are poisonous and 60 to 65 are proven carcinogenic. Carcinogenic means which have the capacity to produce cancer. So imagine a person taking this 4 to 7,000 chemicals, out of which 200 are poisonous and 65 carcinogenic. If he is taking it day in, day out, imagine the harm it will cause to the body. So there is no rocket science into it. If he is taking any kind of tobacco product, he is actually taking so many chemicals which are harming his body. So this is the reality we need to explain to people and tell the people. So people feel something very different that Shah Rukh Khan smokes and this is not the reality. We should tell them what is the reality. Shah Rukh Khan smoking is not the reality. I am showing Shah Rukh Khan because I have personally spoken to so many smokers and majority of them tell them that they started looking at Shah Rukh Khan and they started in the younger age and they started smoking. This is a fact, unfortunately. But we should tell them that this is not the reality. Reality is something different. Reality is cigarette causes a lot of effects on your body. It causes a lot of financial loss. It causes a lot of families are affected. A lot of psychological stress the family has to go through. We'll talk about the harmful effects on the body in detail, but we also need to understand the financial loss what is caused to the person. I mean, if you take the cost of the cigarette every year in the budget, the government increases the price of the cigarette. So the cigarette today costs you almost 10 to 15 rupees a single cigarette. So imagine if a person is smoking 10 cigarettes, he's spending almost 100 to 150 rupees every day. You can calculate into weeks and months and years. So there's a huge financial loss directly also. But if you consider a tobacco product, I mean, which is another chewing kind of a tobacco, if the cost is comparatively less, like 10 to 15 or 20 rupees, but then imagine the disease what he is buying. The disease like a small oral cancer, like a buccal mucosa cancer, if you see the treatment cost is almost in lakhs. And it's not a single treatment like you do a surgery and it gets over. You need to do chemotherapy, radiotherapy, and it's a long-standing treatment. There is a huge financial loss involved, even if you're taking a small tobacco product. Apart from that, if you see the family, how it is affected, I mean, if you the cancer word itself devastates the entire family, and also the entire treatment course, the entire family has to go through immense psychological illness. I have personally worked in cancer hospitals. I know how the relatives have to go through different psychological pressures. This is the reality. What we have to inform the people that real hero is not smoker. He's actually not a hero because this is what happens to him at the end of the day when he's actually affected with so many complications and so many diseases. And as I said, it's not only the health which is affected; it is also the financial and psychological loss. So to begin with, we need to understand first of all about this smoking products. You may feel this is not, I mean, we are aware of all the products, but there are a lot of misconceptions associated with this product. So that is why I need to make this clear, because if you are not aware, you might miss a patient. So cigarettes, everyone is aware of cigarettes, but again in cigarettes, we need to understand that even the cigarette which is promoting itself like a gold flake light, there is nothing light in a gold flake light or a slim cigarette or a low tar cigarette. There is nothing like that. Just remember three things over here, and you should always remember these three things. First thing, no matter what tobacco product it is going to be harmful. No, and the second thing is, no matter what quantity you are consuming it, it is going to be harmful. And third thing is, no matter what duration you are consuming it, it is still going to be harmful. I mean, if you say that I'm not having cigarette, I'm having another product, that is not going to make any difference because the mere presence of tobacco it is going to be harmful. Second thing, the quantity. If you're saying I just smoke 2 cigarettes or I just take 2 gutkhas, even then it is going to be harmful. And third thing is, if you say I just have taken it for like 2 years, 3 years, so I don't think it will affect me. That is again wrong. You may never know. So it is not that only after 10, 15 years of the consumption you are going to get affected. It can happen at any time. So second is the product is BDs. Again, BDs everyone is aware of, but the BDs are kind of unorganized sector. So the cost is very low. So in India, the consumption of BDs is much more in India. The reason being, of course, the cost, and second thing, the easy access or easy availability. So you may not get a medical store at night. You need to struggle for it, but you can get a BD pan anywhere in India at any time. Third is the hookahs. But there is a huge, what we can say, misconception related to hookahs. Around 5 years back, Supreme Court had revoked the law of ban over hookahs, so hookah parlors have started again. But that doesn't mean hookahs are safe. You need to understand that hookahs are 4 times more dangerous than cigarettes. First of all, the hookah session lasts for longer, like they are 1 hour sessions, they are not less than that. So the exposure is more. Secondly, you tend to take hookah, breathe it deep inside. Third thing, as I just mentioned, wherever there is tobacco, it is going to be harmful. So no matter what, there are 200 flavors into it, but if you see even the flavor pack, it will tell you that the nicotine content so and so. So it is still going to be harmful. And there is something important which you should be aware of, is the something called as interstitial lung disease. Now this disease is basically caused by this disease. What happens in this disease is our lungs are elastic organ. That is why when we breathe, it expands. So in this disease, what happens that elasticity is lost. It gets fibrosed. So what happens is it becomes totally like a stone, and there is no treatment available for this disease. And the main reasons for this disease are cigarette, BD, and hookah smoking. I have personally seen people coming to a chest physician with hookah smoking and landing up into interstitial lung disease. Of course, there are other reasons like industrial waste and pollution, but cigarette, BD, and hookah smoking are the main reasons for interstitial lung disease. Apart from this, there are certain products like cheroots and cigars, which are cheroots are basically tobacco in the tobacco leaf itself. It's a very common in villages, and cigars are something which you must have seen in movies. But personally, in spite of so much of years in the field, I have not come across any patient with cigar. But it is still harmful, and it is still a tobacco product. There is another interesting product which is coming up, which is called as electronic cigarettes. Now it is wrongly called as electronic cigarette. Basically, these are drug dispensing devices, and now the name has changed, and it is called as electronic drug dispensing devices, where tobacco is in a nicotine, and tobacco is in a liquid form, and there are batteries into it, so you need not light them. They actually, the smoke comes out because of this combustion from the batteries. And these were introduced as a harm reduction technique, that you can be saved from the harmful effects of smoking and you can try an electronic cigarette. But this is not the right thing, and unfortunately, the cigarette companies, major cigarette companies, only make this e-cigarettes. So, and WHO has not yet approved any of the e-cigarettes. So, and there's a lot of research which is going on and which has come up where electronic cigarettes have how they are affecting the body and how they are also having a lot of carcinogenic elements into it. Fortunately, Indian government has taken the decision to ban e-cigarettes completely, so it's not allowed to sell or buy e-cigarettes in India. But people still get it imported or buy it online. But in India, there is another product like e-hookahs are available. So you should be very careful. Even e-cigarettes are not available, e-hookahs are easily available. But you need to be aware of this product also. There are other products like smokeless tobacco products. As I said, in India, we have a number of smokeless tobacco products. That is the reason the consumption is also more, and that is the reason the cancers are also much more, as we are the world number one in oral cancer. So there are products like Henny where there is tobacco and self-line pre-mixed into it. There are products like Zarda, which is a flavored kind of tobacco. There are products like chewing tobacco and lime, which is the most common thing. There are other products like Gutka, everyone is aware of. There are products like Mava. I guess all of you are also aware of Mava with a plastic, there is plastic paper, there is this ingredients like supari and tobacco and other flavors into it, and they keep these goodies. I've personally seen big goodies. I mean, the size of goodies bigger in Gujarat than in Mumbai. That is my personal experience. Pan, again, there is a lot of controversy with pan because people feel, of course, if it is a tobacco pan, it is definitely going to be dangerous. But there will be people who will tell you, I just have a sada pan or a meetha pan. But you need to understand what are the ingredients in the sada pan. Sometimes it happens that there is something called as this kimam into it. Now, this kimam is nothing but a tobacco tree. So even if you are having a sada pan, unknowingly, if this kimam is present, you are consuming tobacco and you are going to land up in problem. Another thing is supari. Now, supari and arak and tobacco are two different things, but supari again has proven to be having a lot of carcinogenic elements into it, and supari is causing a lot of diseases. We get a lot of patients from Northeast, and the supari consumption has actually caused them some fibrosis and a lot of other cancers also. Apart from that, there is something called as masheri, where tobacco is burnt and the fine powder is created and it is applied on the gums. It is common in Maharashtra and with women also. And there are also sophisticated toothpaste which come. I don't have the image over here, but these toothpaste are with brand name Ipco and Dentobag. But this Ipco and Dentobag are sophisticated tobacco toothpaste, which I have seen people applying it after having their breakfast and keep applying to their gums. So again, this is an addiction and people don't know or they don't feel that it is that dangerous. So this is again a type of tobacco products only. Apart from that, there is also fine tobacco powder which is taken through the nose. It is called as tapkir or naswar or chinkni in different terms, in different languages. But again, this tobacco is taken through the nose like a snuff, and that is also proven to be dangerous. I've personally come across patients who have suffered with cancers after the consumption of these snuffs. So these are not entire tobacco products, but definitely there are much more products in India, as I said, and in spite of working for so much time in the tobacco field, I'm not still sure that I'm aware of all the tobacco products or I have seen all the tobacco products, because there are so many tobacco products in India. So you keep the basic thing in mind that wherever there is tobacco, it is going to be harmful. The moment you come to know that there is tobacco into it, it is going to be harmful. So you must have seen this particular advertise. It's was by Tata Memorial Hospital. This advertise comes before the movies where the person says कि मेरा नाम मुकेश है और मैं 4 साल से गुटखा खाता था. This was a live actual case. A guy of 24 years was admitted to Tata Memorial Hospital. Unfortunately, he expired. But what he says is very important. That my name is Mukesh and I used to consume for just 4 years. So in just consuming tobacco, gutka into cancer, and he is no more. You need to understand that a lot of misconceptions among public that if I have a longer period only, then I'm going to get affected. So that is not the case. So you should tell them about this case also. So again and again, I'm telling you there's a lot of chemicals which are present into it which affect you. So what are these chemicals? So just to explain the general public, you should tell them this. Show them the regular products what they use in their day-to-day life, like ammonia in detergent powder, the toluene or cadmium in their batteries or paint, acetone in their paint. So, I mean, how many of you are going to eat your detergent powder or drink your paint and all? See, we are not going to do it because we know that these are poisonous. But a person who is actually smoking or consuming tobacco is actually consuming these hazardous chemicals, but they are not aware of it. So you need to make them aware that these are the chemicals, these are the hazardous chemicals which you are taking in your body. So I mean, it's enough to tell them that if you're taking these chemicals, it is bound that these chemicals are going to create effect in your body and are going to cause problems in your body. So in India, as I said, the huge consumption, so the people dying with it is almost 10 to 13 lakh people annually, which is a big number. So it's more than deaths caused because of HIV, AIDS, malaria, and tuberculosis combined together. So deaths caused by tobacco-related disease much more than these 3 big diseases combined together. That bigger is the impact of tobacco in India. There is something called as secondhand smoking. Most of you must be aware of it, like the passive smoking or secondhand smoking. That if you are not personally consuming cigarette, but if you come in contact with a person who is directly smoking and you are coming in contact with that smoke, it is called as secondhand smoking or passive smoking. And the number of deaths, what I showed you now, almost research says that 5 to 6% of these deaths are caused by secondhand smoking. I'm talking about deaths. People get affected with diseases because of secondhand smoking, and actually people die because of it. So this is a huge number again. So secondhand smoking is also very dangerous, and you need to be explaining this to people about this also. It's something called as third-hand smoking also. Now, what do you mean by third-hand smoking? So if you enter an empty room and you see that, you feel that someone must have smoked over here. Why do you feel so? Definitely someone must have smoked over there. That is the reason you are feeling it. And because the particles stay there for a longer time, and this third eye smoking also has a lot of effects on the body, and a lot of research is being done on it now, and it is shown that it is also causing a lot of diseases. Like there was a study where children were getting respiratory complaints, so they asked the parents about the smoking habits. The parents said that we do smoke, but we don't smoke in front of them, but we stay in the same house. That is the impact it was causing. Even they were not smoking in front of them, but still it was affecting the children. So third hand smoking is also something which you should know. So we talk about what are the health effects. Won't go into details of it, but I'll tell you the main things like short-term effects are like ear infection, sore throat, your yellow decayed teeth, bad breath, smelly hair, smell disorders like in we don't have the sense of taste and smell is lost. Wrinkled skin, watery eyes, itching eyes, dark circle below the eyes, concentration, problem in concentrating. So this is something interesting that the white spots in the mouth, we call it leukoplakia or the red spot or erythroplakia or submucous fibrosis. Normally we can put 4 fingers in your mouth, but a person who is into good kind of tobacco chewing, the mouth openings start reducing because of the stiffness of the muscles, mouth muscles. So this is called as submucous fibrosis. So research says if a person has consumed a smokeless tobacco product for say like more than 3 years, more than 50% of this population will start showing these particular symptoms like white spot or red spot or submucous fibrosis, and these are called as precancerous conditions. Means this, if they continue at this stage, in spite of having these conditions, they are definitely going to land up into cancers. And research says that more than 50% of people who have consumed it for more than 3 years will definitely get this symptom. So if you're in history taking, you come to know that a person has consumed tobacco for more than 3 years, you should immediately look out for such sign. Because there is a huge motivation for the person to tell him that this is definitely going to land up into cancer, so you better stop it and you can then help him to quit. So you should first be aware that these conditions are called as precancerous conditions and look for in the patients who are consuming tobacco. Then another non-healing ulcers are also one of the signs. As I said, because of the huge number of population consuming tobacco and a huge number of products in India, India is the number one in oral cancers, and 90% of oral cancers are tobacco related. So it is as common, and it is also if the population stops consumption of tobacco, the cancer cases, oral cancer cases will definitely drop down. These are the other organs which are affected by cancer. It's not just the lung, but almost 16 different organs which can get affected because of smoking, and it can cause cancers of these particular organs. Apart from cancers, it causes a lot of respiratory diseases like chronic bronchitis, reduced lung function, asthma, heart diseases like coronary heart disease, heart attack, emphysema. These are the diseases caused by smoking. Gum diseases, tuberculosis. Now, what is the relation between tuberculosis and tobacco? So basically, tobacco has inherent capacity to kill your appetite. If your appetite is killed, you won't get hungry or you won't eat food. If you don't eat, your immunity will drop down. So once your immunity is dropped down, you're exposed to a lot of infectious diseases, and the most common disease is tuberculosis. And in the current scenario, if you see, the most infectious disease is COVID. So it is always said in even this current situation that you should see to it that your immunity is good. But if you're consuming tobacco, your immunity will be compromised and you will land up in infectious diseases like tuberculosis and COVID. So that is how tobacco and tuberculosis is related. Same with diabetes. The person who is consuming tobacco, basically pseudo-glucose is released in the body, and that is why the body feels that it doesn't feel like eating, and it affects your diabetes also. And the person who is consuming tobacco will never be able to keep his sugars normal. Another thing, there can be early cataracts in people who are consuming tobacco. Gangrene. Now, what happens is that the blood vessels get constricted, and because of that, the peripheral blood vessels, the blood supply is not good. So the organs start getting, gangrene. And the poison from this part should not spread to other regions. So this has to be cut. It has to be amputated. And this is much common condition, also known as smoker's gangrene also. If the blood supply to your brain is compromised, you get stroke, paralysis. If the blood supply to the heart is compromised, you get heart attacks. And the eye also, you get macular degenerations and blurred vision. Among women also, there are a lot of problems. So impotency, infertility, miscarriage, stillbirth, low birth weight babies, sudden infant death syndrome. So a lot of reproductive system and pregnancy related problems are found in women. And if you see, unfortunately, the girl smoking is rising. Smokeless consumption was always there in women also. In fact, smokeless was more than smoking, but now you can see even the smoking is on the rise, and especially in the cities, you can see a girl smoking, which you should have not seen like 10 years back, but now you can easily see girls smoking also. Unfortunately, these are all educated girls, and in spite of that, the awareness of tobacco has a lot of effect. They still do it. So we need to explain them that what are the consequences they would face in future, which they may not be aware of. We should tell them what the harsh realities which they are going to face because of this particular habit. So we should not only talk about the harmful effects, like we spoke about the effects on the body, the financial impact, and the social and psychological impact also. But we should not only talk about the negative things, we should also always talk about the positive things. And this is what I have realized, that these positive things actually will connect you to the patient, and they will take the informed decision to quit, and that is the time you can help them. So a lot of positive things also should be informed, and not just the negative things. So what do you mean by positive things? Like the health benefit, the economic benefits, and social benefits should also be informed. So, like health benefits, I explain them that if a person falls down and gets an injury, that injury won't remain for lifelong. Why? Because there is a continuous self-regeneration and repair process going on in the body. Similarly, a person who has consumed tobacco for so many years, he's already damaged his body because of the chemicals present in the tobacco products. But at the same time, when the person stops taking this tobacco product, there is a repair and there is a good changes happening in the body. So you should inform them about this also. So there is a proper research on this already present, where what are the good changes happening in the body from 20 minutes of quitting smoking to 15 years of quitting smoking. So within 20 minutes, your pulse rate and blood pressure drops to normal. Within 12 hours, your carbon monoxide level drops to normal. Within 2 to 12 weeks, your lung function test starts improving. Within 6 months, your chest congestion and cough goes away. Within 5 to 10 years, risk to heart attack and stroke drops to 50%. Within 15 years, you are as good as a non-smoker for any cardiovascular diseases. So imagine the person can come to a level of a non-smoker. So this message has to be conveyed to the person, because that is what will motivate him to quit. And as earlier he quits, the earlier he will get these good changes will start in his body. So this is something you can by heart, some important points about this, and always mention to people who have been consuming tobacco, so that they make a decision to quit, and then you can get them out of this habit. Apart from this, there are also economic benefit. As I said, there is a direct money can be saved, and the future health expenses can also be saved. And social psychological impact, like the children would not get into it, because children look at the parents and they start it, and no parent would want their children to consume it. And of course, there are a lot of personal benefits also, personal social benefits also associated with the tobacco products. That also the person will get. So a lot of benefits are also there of quitting, that needs to be informed to the person, so that he comes to a level where he takes a decision to quit. A lot of environmental impact also, but I'm not going into the details of this. But now we'll try to understand that, first of all, when you're working in this addiction and we want the person to get out of this, or we need to understand why people get into addiction. So there are four main reasons why do people get into addiction. There is the senior psychiatrist, Dr. Anand Nadkarni, who is working in addiction field, and he's a senior person. He is one of the expert in the field. So according to him, there is four main reasons why do people get into any kind of addiction. I'm not talking only of tobacco now. I'm talking in general about addiction. Tobacco is also one addiction. So why do people get into addiction? The first reason is the characteristic of the chemicals present in this addictive substances. So what do you mean by that? So there is something present in tobacco, there is something present in alcohol. So these chemicals present in tobacco and alcohol, they have the characteristic that they are by characteristic addictive in nature. So in tobacco, there is something called as nicotine. Now, nicotine is one of the most addictive substances in the world. Like gold has some characteristic, silver has some characteristic. Nicotine, by characteristic that it has the characteristic that it is addictive. Means what it will go to your, once you consume it, it will go and create some receptor level changes, and these receptors will keep on demanding for more nicotine. In simple terms, if 10 people smoke for the first time, there are high chances that 7 to 8 out of them can get into this habit. This high level is the addiction level of this particular chemicals. There is something else in alcohol and some other chemicals in other narcotic drugs. But the characteristic of these chemicals present in these substances is that they are addictive in nature. So second thing is a person's personality. This personality plays a very important role. I can give you a small example for this that if my personality is good, I can say no to wrong things. So I did a program with a traffic police in Navi Mumbai in Maharashtra, where I thought because of the stressful and long duty hours, I mean this could be a good target audience because they must be 90% of them must be tobacco consumers. But to my surprise, out of this, only 33%, to be very specific, were into this habit. Others were not into it. So I realized that it's not only about it. Others had that kind of a personality where they could say no to wrong things. So in spite of working in all those conditions. So personality plays a very important role. Third is the friend and family support. Now, it is known that if it's a good company, you don't get into it. But a friend and family support is also important to get out of the this particular addictions also. So we always, when we design a treatment, we always try to involve a quit buddy or a friend, family support into it, so to make the quitting process simple. So friend and family support, I can give another case study where there was this Vietnam War where US soldiers were deployed in Vietnam, and this war was for a long time. At the same time, this was not much of an actual war, it was more of a cold war, but the soldiers were there, so they were given a lot of drugs also. But when the war got over and the soldiers came back to their families, 99% of them were off the drugs. So if you see the characteristic of the chemicals is the only reason all these soldiers should have continued it. But at the time when they come back to their friend family, all of them were out of the drugs. So try to understand friend and family support plays a very important role. And fourth is the stressful conditions. It is often seen that people working in stressful conditions, the chances of them getting into this habit increases. So this has been proven by research also. Okay, that tend to go to addiction because they are going through a lot of environmental stress or whatever, work-related stress. So they feel that they should get into addictions, and that is come to their survival. But of course, this is not the right way, but that is what research shows. So these are the four important reasons why do people get into addictions. Another reason, in spite of this, tobacco packet has written over it that tobacco causes cancer and a lot of awareness present. Why do people still consume tobacco, cigarette, or in any form? That is because, I mean, I'm talking about why do people start it. So it is a lot of curiosity among young people that they should try everything once in life, or there is a lot of curiosity. Now I'm come to the college, so I've grown up, I should try this. So there is one reason is curiosity. Second is peer pressure. Now peer pressure has come to be a big, factor for youngsters getting into it. We had done a survey about girls smoking in university, where again the peer pressure has come up as one of the big reasons why these girls were getting into smoking. People feel they look cool because that is the image they have in their mind, or it's fashionable, or it is stylish. Unfortunately, it is shown and showcased in our films and advertisements that way. That is the reason why youngsters fall prey to it. Unfortunately, these actors get paid very high to do this advertisement, like Zuba Kesari and all. I mean, people like Ajay Devgan or Akshay Kumar, who used to be a fitness freak, they also do some advertisement for pan masalas. So it is very wrong actually, because they get a huge amount of money for it, but entire generations are getting spoiled or getting impacted because of such kind of advertisement. But unfortunately, people are followed by youngsters, and today we don't have real idols like Abdul Kalam and all, and people unfortunately follow such people and they land up into addictions. Uh, as I said, tobacco has capacity to kill your appetite. A lot of models use it to stay slim, but this is not the right way because the repercussions of it are very bad. Tobacco companies have a lot of money and they do a lot of research and spend a lot of money in attracting their consumers. For example, women's brand like woman only brand of feminized or long extra slim kind of thing just to attract their woman audiences. So this is just an example. Similarly, there are a lot of amount of money spent in other advertisements attracting their consumers. People feel, as I said, tension is correlated with tobacco consumption because they feel if they smoke, their tension will be reduced. If they consume tobacco, their tension will be reduced. So this is something, a huge misconception, a huge psychological correlation they have developed with this product, which is absolutely wrong. And this is, again, this needs to be informed at how it is impacting them rather than benefiting them. Constipation is another big misconception. People feel that पेट साफ करने के लिए, I mean, for smooth bowel movements, they need to consume tobacco. You need to sit and explain the person that a person who tells you that he consumes tobacco for a smooth bowel movement, he must be taking it entire throughout a day also. So the morning one was just an excuse. Second thing, he must have started at the age of 15 to 20. The first 15 years is to get a smooth bowel movement. So again, that is not true. Third is, if he has good salad and fibrous food, he will not suffer from constipation. Fourth is, there is something called a gastrocolic reflex in the morning. Instead of tobacco or smoking, if he takes hot water or hot tea, it will have the same impact and he won't suffer from constipation. Fifth is, in spite of all this, if he is suffering from constipation, he can go to a doctor and take medicines. No doctor is ever going to prescribe like, oh, you're suffering from constipation, you take 3 BDs or 3 gutkas. No, the doctor won't tell this because this is not a medicine and it cannot be taken in the form of medicine. We need to understand and explain the person the facts, the realities, and break this kind of psychological association what he has developed with such products. So the fact always remains that this is the number one killer. It is killing so many people and it is affecting so many people. To show them the realities, how this is affecting people and how it is impacting their lives. So these tobacco cessation part, this is something again very important because again there are a lot of misconceptions. People feel that it is impossible to quit. First misconception. No, it is not like that. It is definitely possible to quit, and many people also want to quit. And if proper guidance and help is provided, definitely many people are interested in quitting, and many people also come out of it. My personal experience, I've been when I practiced in the hospital, the success rate was almost 57 to 67%. I mean, it was that many people, percentage is a huge, like more than 50%, was succeeded in getting out of this habit. So definitely it is possible to quit tobacco. And another thing is, people are not aware that there is help available. There is help available. There are people like you who are working to help people to get out of this habit and helping them to quit tobacco. So these are two major misconceptions which people have is that first is it's not impossible to quit, and second thing, there is no help available. So you need to talk to the person and tell them that it is definitely possible and there are people who are working for it and you can also help them to quit this habit. There are certain basic things when we talk to the person about tobacco, when we talk about the entire tobacco treatment. Of course, this cannot be covered in this short span the tobacco treatment in detail, but I can give you some few tips which you can give to people in generalized tips. Of course, when we sit with the person, it has to be very customized. But certain general tips you can give the person you can. The first thing you declare about it. Once you declare about it, you have accepted it, and your family friends are also aware of it. So your family will support you into it. Your friends won't do it in front of you. Then you have to avoid people and places where you are tempted to consume tobacco. You can do some activities like take your hobbies that keep your hands busy, count 1 to 100 or recall happy moments in your life. Exercising is important because when this nicotine reaches your brain, dopamine is released, and when this dopamine is released, which is the feel-good factor, same dopamine is released when you have your favorite food in front of you, or when you are uh, listening to your favorite music. And same dopamine is released when you're exercising. So exercising not only helps you in getting your dopamine dose, but exercise also gives a lot of discipline to you. The person who is exercising will have control on his habits. So exercising is another important thing we should tell every person to do who is going through the journey of quitting. Another thing is the urge what you get to smoke. It is very high in the first 3 to 5 minutes, and over a period of time, like 20 minutes, disappear. So this initial 5 to 10 minutes, you need to be very careful. So what you can do is you can follow something called as 4 Ds. The English letter D, D for Delhi. The first D is drink water. So when you get a strong urge to get smoke or to consume tobacco, you can take a glass of water and slowly sip, drink it sip by sip. When you're doing this, your entire attention is on the drinking, and slowly, because of the water, also your mind gets a little relaxed. So it helps in diverting in your mind. The first is drink water. Second is deep breathing. Now also you're breathing, but once you start deep breathing, your entire attention is on your breath. So it helps again to come out of or be to divert your mind from the tobacco urge. Third is delay. You can convince yourself, okay, I will have after some time. मैं थोड़ी देर बाद खाऊंगा. Okay, you have to just push it as long as you can, and there will a point will come that it actually you have overcome that urge. So keep on pushing it as much as possible. You may find it very simple, but I have personally witnessed, and it has helped many people. I mean, even the delay technique has helped people. The fourth is do something else. Do something else where you're, like your hands are busy, or more than one senses are involved, like playing a video game or something which is involving your 2 or more senses. This will again help to keep you occupied and help you to divert your mind. So this 4 is again a very simple, like drink water, deep breathing, do some delay, and do something else. Drink water also helps you get all the toxins out from your body. Discuss and talk about your thoughts and feelings with an expert, because the expert can guide you in a proper what are difficulties you are facing, and can take you give you a proper guided plan, because each one has different mind sets and different problems. So an expert can guide you properly. Expert can also guide you with proper medications. Now there are this Nicotex chewing gum which are more popular among public. Like people don't even know this is nicotine. Any other brand, people are well versed with Nicotex, but there are other companies also. But try to understand the logic behind this chewing gums and patches. These are the medicine which are used, but try to understand how they work. So basically what happens is, as I explained to you in the beginning, when a person is smoking, he is exposed to like 4,000 to 7,000 chemicals. Out of which 200 are poisonous and 65 are carcinogenic. Out of this, the main culprit is nicotine. And which nicotine is what the brain wants, or the addiction is of nicotine and not of the other 7,000 chemicals. So what they have done is they have taken out the nicotine and removed all the other chemicals, out of which many are harmful to the body. And whether you get the urge to smoke, you have to just put a chewing gum or you take the patch, and the nicotine will reach your brain and the urge will subside. So this is the basic mechanism which is called as nicotine replacement therapy. So you are replacing the nicotine from a tobacco into crude form, so that the person is able to overcome this particular demand of nicotine, and the urge is subside. So he did not smoke or he did not chew any kind of tobacco. So this is the basic thing. First, we need to understand the logic behind this chewing gum and the patches. So these are just the forms of nicotine replacement therapies. It can come in the chewing gum, patch, or the lozenges form, which are popular in India. We don't get inhalers in India or sprays in India, but understand that how it works. You are just replacing the nicotine from tobacco into crude form. So whenever there is an urge to smoke or chew tobacco, you can have this so that the urge subsides. Of course, there are advantages of each one, like the chewing gum, you have to eat, but patch, once put it, the 24-hour patch, there is a continuous nicotine release, and the brain gets continuous dose of nicotine for 24 hours. Next day, you can remove it. The chewing gums, again, are available in different potencies, like 4 milligram, 2 milligram. And another thing is, this is a OTC product, so you do not require a prescription. So you should take it under the expert guidance, because the expert can guide you properly which potency, and there is a method of taking it. Like there is a chew and puff method. So this nicotine treatment replacement therapy is definitely good, but again, this is not the entire treatment. It is just one part of the treatment, and all patients don't need it. Only the expert can decide which patient requires it. It has to be given to a highly physical dependent person. So you need to understand first that it is not required to give to every person, and it has a proper method of consuming. Secondly, the dose has to be tapered. So it's not that you just take the chewing gum and you can come out of the habit. Tomorrow, if you don't get the chewing gum, you will go back to smoking. So we don't want that. So whatever tobacco de-addiction treatment it is, the 80% is counseling, 15% is NRTs, and 5% is a little bit of the antidepressants or blockers. But major thing is counseling. And no matter which theory you're practicing across the world, everyone talks about counseling and gives that importance to counseling because it's not just a physical addiction, it is also psychological and behavioral addiction. And we need to take care of that part also. So even though it's a OTC product, take it under the proper expert guidance. You can give it in a proper dose and eventually taper the dose and get you out of this habit. So that was it from my side. This is our Indian Cancer Society's links, where you can follow us and get more information. And I can open it now for question answer session.
Yeah, that was a very concise presentation of whatever a student has to know. Thank you so much, Dr. Rohan. We would definitely like to hear you more about the treatment protocols we follow,
Sure.
both pharmacological and
Yes,
non-pharmacological treatment protocols. And so I would just like to ask you, Dr. Rohan, what are the opportunity for students, like if they want to take up this tobacco cessation field?
Yeah, so this is a very important question because as you see, there are not many people working in this field. I mean, I'm personally working for more than 5 years now, so I'm aware of it. At the same time, if you see the number of tobacco consumers, I mean, it's in millions. So you need to understand that so many people are into it. And if you see, forget about other diseases, just cancer also you consider today, the cancer rate is increasing so much. I mean, if you see oral cancer data, between 2012 to 2018, the cancer cases have actually doubled, more than doubled. I mean, it is that rapid growth of cancer which is happening. Personally in Mumbai, I have witnessed that people are coming up with cancer hospitals. So we need to understand that tobacco is one of the most preventable cause of diseases. I understand that tobacco is not the only cause of cancer, but try to understand that so many people are into it and we need to save them before they get into this habit. Before they get into this deadly disease, we need to take them out of it. Another thing is tobacco de-addiction requires a little bit of good follow-up and little bit of dedication and commitment towards a patient, and that is the reason it is little bit of time consuming also because you have to do a regular follow-up with the patient. And because addiction itself is such a field where you don't get quick results like malaria or dengue treatment that you give a medicine and you get a results. But it does take time. Every people, as I said, a different mindset, and some people can show you results immediately. Some people you might have. The success rate differs from patient to patient also. That is the reason people or doctors majorly don't indulge in it more. But at the same time, I'm telling you, it is so much required in today's what you can say world because people are going out through so much stress, and with tobacco, they are adding to the stress and adding to the diseases. This is the one part of it. Second part of it is no matter what best treatment the cardiologist or diabetologist or the neurologist is giving to them, if the person is into tobacco habit, it is going to act as an obstacle to cure. So in spite of the best treatment, they will not be benefited. So they also need people who can help people to quit, and they can definitely refer. I get a lot of references from different fraternities, and that is how people. We need to help these people, and who can work with a lot of other specialties. Oral dentists, so definitely you can collaborate with because dentist is the first person to check about the precancerous condition lesions, and immediately that is the best time to counsel the person. So it is definitely people can take about it and take it up, and more thousands of people are required like you can help tobacco consumers because that high is the consumption of tobacco in our country, and there is immense scope about it. And it is not a rocket science. It is not that difficult to practice also. WHO has given good protocols if you stick to that, and it is not something complex thing also. It is difficult to practice also. So I think people can definitely take it forward, and they can also do it along with whatever existing profession they are doing. Some amount of time they can keep for tobacco cessation patients, and even that could work for them. But it is a huge of what you can say. Social impact what you will get, and the immense what you can say job satisfaction you will get when your family is saved, because when I'm saving a person and getting him out of the habit, I'm actually saving the entire family. So that is something which is cannot be compared with anything else. Thank you.
Yeah, as you rightly said, the number of cases are increasing, especially in youngsters. They are getting attracted from the media, and even here, like even in a B town city, I see a lot of youngsters, especially girls, smoking, and that really hurts us.
Actually,
So, and we lose the productive age group into disease because of this habit. So, which I think all of us hold the responsibility to take care of this situation, and there is also a lot of thought process even amongst doctors or medical practitioners, as you rightly said. No, वो सब छोड़ेंगे नहीं आदत को. No, it's waste of time.
we have
But
to change that mindset. Yeah.
yes, especially with medical practitioners themselves, I feel we also hold social responsibility and
Absolutely. It is our moral responsibility to not just give the person medicine, but also tell him or teach him how to stay healthy. And that is what in the current COVID time is more important. Not just giving vaccine is going to help the person. We should at the same time tell him that along with this vaccine, you also need to have good food, you need to exercise, and you also need to have good sleep. If you are taking a vaccine and you're eating anything, you're not having a proper sleep, or you're not exercising, it is not the right way of doing it. So definitely we need to tell them about right things. As a doctor, it's our moral responsibility.
correct. So if we are being more empathetic with patients, and if we counsel them rightly, I think we will make a huge difference, and we will definitely prevent deadly diseases like cancer and lung diseases which are caused due to tobacco.
I would like to just add something that what has happened over a period of years is this tobacco lobby is becoming more stronger and stronger. Of course, they are earning a lot of money out of it. And imagine the amount of energy and they are putting up in the creativity. They are attracting, putting these actors into it and all. And somewhere we as well practice competing up to their level. We are fighting to a big giant, and we are not. So once we are also at that level, definitely we can make a difference.
Correct, absolutely. So this is the baby step which is taken by us towards that, and we really hope to associate with you more in terms of research for the students also, and for collaborating and working towards a better society. So it was lovely hearing to you, Dr. Rohan. And
any more questions are there? I can answer.
It's not there in the group right now, so I think I would mail you the questions if something comes up, and then we can connect up again.
Definitely.
Okay, thank you so much for your time.
Thank you, my pleasure. Thank you so much.
Thank you so much.